So my name is Alexis, and my presentation is on cystic fibrosis. So cystic fibrosis, also known as CF, is a progressive genetic disease that causes persistent lung infections and limits the ability over time to breathe. People with CF tend to have a sticky mucus built up inside of their lungs. They can also have it in places like their pancreas and other organs. So here are some stats on cystic fibrosis. So cystic fibrosis has a higher incidence in the U.S. As opposed to other countries. Approximately 30,000 people in the U.S. Have been diagnosed with CF. About 75% of those patients were diagnosed by about 2 years of age. About more than 10 million Americans are actually carriers for this disease. Life expectancy in the past has increased. The current life expectancy right now is about 33 years of age, although some people have been known to live into their 50s or late 60s. The most common people diagnosed with CF are actually Caucasians of Northern European descent. So the cause of CF is a defective gene. So a person with CF will inherit 2 copies of the defective gene from their parents. One from each parent specifically. This is an autosomal recessive disorder, meaning that you're going to need 2 copies of the defective gene to be recessive in order to receive the disease. Both parents must have at least 1 copy of the defective gene in order to be considered a carrier. And this defective gene is a result of a mutation. There are about 1,700 different kinds of mutations of this disease, and we're still actually finding more. So some risk factors for CF would obviously be your parents' genes. So there's not much you can do about this, unfortunately, but there are certain factors that can determine the severity of the disease. So one of them is the 2 classes of mutations that you experience with CF. So class 1, 2, and 3 are a more severe and aggressive form of CF, and classes 4 and 5 are a bit milder. You can also do things with your environment and lifestyle to help CF or to worsen the disease. So not eating enough calories, not exercising, smoking or secondhand smoking, as well as drinking alcohol can actually worsen the signs and symptoms and the effects of CF. And age also is a huge factor. CF actually worsens with age. So some signs and symptoms of CF would be salty and tasting skin. So children with CF will actually have a more saltier texture to them. So when you kiss a child like this, like say on the forehead, the cheek, the lips, whatever, their skin is actually going to taste very salty. It can also kind of feel like a sweaty kiss. They're also going to have persistent cough with phlegm, frequent lung infections like pneumonia or bronchitis. They're going to have wheezing, shortness of breath, poor growth, and weight gain in spite of a good appetite. Greasy and bulky stools, which also goes along with difficulty with bowel movements, as well as males can experience infertility. So cystic fibrosis, specifically in the lungs, is the most serious complication of CF. A thick mucus secretion in the lungs actually blocks the bronchi, causing difficulty breathing. So secretions can also trap bacteria in the lungs, which increases the risk for respiratory infections like pneumonia. This specific complication of CF most often leads to death from respiratory failure. So in the pancreas, cystic fibrosis blocks exocrine ducts. So this decreases the amount of pancreatic enzymes delivered to the intestine. It also results in poor digestion and possible weight loss, even though your appetite is good. Cystic fibrosis in the sweat glands causes you to perspire excessively and lose large amounts of sodium. This is why children have that salty texture to their skin. So this loss of sodium causes an increased risk for heat exhaustion and electrolyte imbalances in kids and adults with cystic fibrosis. And this abnormal excretion of salt is usually the first thing that pediatricians, physicians, parents, guardians, whoever notices when they first realize that their child has CF. Like I said earlier, this child, when kissed, will taste salty or have sweaty type kisses. So the diagnosis for CF, most common is the sweat test. Secondly, you can do gene testing or gene mapping, but most likely you can just do a sweat test, and then you can also look at an x-ray of the chest to see, if there's buildup in the lungs. So treatment for CF, there is no cure for this disease. It's fatal. So treatment for this disease is more directed towards reducing the complications and improving the quality of life for children and adults with CF. Respiratory treatment can be postural drainage, antibiotics, bronchodilators, oxygen therapy to help these kids breathe. Also, pancreatic enzyme supplements are available, and if you stay on a high-calorie, high-sodium diet, that also helps as well. And then, of course, we provide emotional support not only for the person diagnosed with CF, but also for the parents. Those are my resources. Thank you very much.